please. Yeah. Yes. Good morning, ladies and gentlemen. This is Dr. P.V. Rao, Principal, St. Mary's College of Pharmacy. First of all, I would like to thank my heartfelt thanks to our beloved chairman, sir, who has given opportunity as a convener for this webinar. And also, I am very much thankful to our beloved MD, sir, and my campus in charge, Mr. Y. Raghav Garu. And my heartfelt thanks to our today's speaker, Dr. Syed.Attif Abbas, faculty and my dear students. Good morning to one and all. As a convener of this first online international webinar on global use of herbal and traditional medicine, I am very much delighted to welcome you all, the students, faculty, expert, research scholars, and academicians from different colleges and different universities. While much encouragement and progress is going on these days in the field of digital technology, I can say proudly, with honestly, that on behalf of St. Mary's Group of Institutions, St. Mary's College of Pharmacy conducted 450 online classes and 28 guest lecturers from different states within a span of 1 month, with 80% attendance. I am very much proud to say that we conducted e-poster competition and online quiz also. For that also, we received huge response from all different colleges. So these are all happened by my excellent cooperation of my students and my faculty. I am very happy to say that the strength of the faculty. I hope that the St. Mary's College of Pharmacy utilized this online platform much impressive. So we know the quotation, time is our most precious asset. We should invest it wisely. So students, if you lose the time, we cannot find it. So based upon the quotation, we strictly followed this quotation so that we utilize the maximum time in this pandemic and pathologic situations also. Today, we are conducting this online webinar by an international speaker, Dr. Syed.Attif Abbas, Deputy Dean, Quest International University, Malaysia. It is great honor and pleasure to introduce Dr. Syed.Attif Abbas. He completed his obtained his PhD in pharmacology from the University of Sains, Malaysia in the year 2003 under scholarship awarded by Malaysian Technical Cooperation Program. An MSc in pharmacology from University of Sains, Malaysia in the year 1999 and Bachelor of Pharmacy from University of Punjab respectively. Her current research focus is on cardiovascular and renal pharmacology. He is a
Sorry for the inconvenience, sir. Good afternoon, Dr. Syed, sir. Sir, can you please start your lecture?
Okay, good afternoon. Can you hear me, Mr. Prasanna?
Yes, sir. Yes, sir. It is audible to us.
Okay, thank you very much. Good afternoon, my fellow friends in Malaysia, and good morning, my friends in India. First of all, thank you very much for giving me this opportunity to talk on this topic, that is the global use of herbal and traditional medicine. And I added the point that are we still looking for a magic bullet? Before I start, I would like to have my special thanks to Dr. Ref KV Rao Garu, Chairman, St. Mary's Group of Institutions, Mr. V. Ratnakar Reddy Garu, MD, St. Mary's Group of Institutions, Mr. Y. Raghava Garu, Campus In Charge, Dr. P.V. Rao, Principal, St. Mary's College of Pharmacy. So thank you very much for giving me this opportunity to say some words and some thoughts on this topic. Thank you very much, Dr. Rao, for giving my introduction. My name is Syed.Attif Abbas, and I'm the Deputy Dean, Faculty of Pharmacy, Quest International University, Malaysia. Just to give you a very brief introduction about our faculty of Pharmacy, we offer the degree in Pharmacy Honors, a Bachelor in Pharmacy Honors, and this degree is recognized fully by the Malaysian Pharmacy Board at the excellent status. And also we have our postgraduate students. We offer Masters and PhD program. Our students in Masters and PhD, they are working in different fields like in clinical pharmacy, pharmacy practice, pharmaceutical chemistry, bioinformatics, information technology, pharmaceutics and pharmaceutical technology, and drug design. So this is a very brief introduction about our faculty. So I would like to start the topic for today, and I hope that you all will bear with me. Different cultures and different religions have different thoughts on the cure of the disease. I'm just giving you an example from my faith that that God or Allah never give us a disease without a cure. So I think that's in most of the religions, that thing. And if we go back to the human history, the disease and the cure for the disease always go side by side. Since we know the human history. And whenever there is a disease, it is the nature of the human to search for the cure. Now, if we go to the prehistoric age, and maybe until today also, we search of cure from the supernatural sources. We try to find the cure of the disease from the supernatural sources. And also, we try to search of cure from the nature. Nature, we try to find the cure from the plants, from the animals, and from the minerals, or maybe the combination of these things, or sometimes the combination of supernatural and natural things. So that is still going on. Now, what we know about traditional medicine, or what is traditional medicine? So basically this definition is from WHO, that the traditional medicine is the total knowledge, skills, and practices. So you can see the key word here is not only the knowledge and skills, but also the practices based on the theories, beliefs, and experiences indigenous to different cultures. So it's not confined to one part of the world. Traditional medicines, they are used globally. Every part of the world with different beliefs, with different theories, with different experiences, and with different practices. And these traditional medicines, they are used to treat the physical as well as the mental illnesses. So in general, these traditional medicines, they are considered as an alternative treatments which are widely used in developing countries. Or rather, I changed my sentence here. They were used in the developing countries, but the scenario has changed now. And these traditional and alternative medicines, they are becoming more popular in most developed countries as well. I will just give you some example based on the dollar and cents, how much people they are spending on these traditional medicines. And we will be surprised to see that how big is the market economically, this traditional or herbal medicines market. Usually, these traditional medicines, they are made from various types of medicinal plants. Sometimes they contain other ingredients such as I mentioned, either from the animal parts or from the minerals. Or sometimes they are mixed together. The herbal, the herbs, the animal parts, and the minerals, they are mixed together. And these traditional medicines, they are usually dispensed by pre-mixed, patented preparations, and sometimes they are freshly made by the practitioners or the herbalist or by the traditional physicians. We all know that there are different dosage forms which are available. These traditional medicines can be taken as a raw form, can be taken as a tea, as a decoction, or the paste, or powders, or maybe it can be packed in the form of pills or liquids for the ease of consumption and retailing. So all the different dosage forms, these traditional medicines, they are available. This information is from WHO, that more than 70% of the population all over the world rely on non-conventional medicines. So you can assume, you can see that 70% of the population globally, they are using this traditional or alternative, or we can call them complementary medicines. 70% is a huge amount. Is a huge amount of people they are using or they rely on the non-conventional medicines. And this huge percentage of usage indicates that's the setback, the lack of knowledge among the public about the benefits of conventional medicine, which derive them towards alternative options, not forgetting the publicity and myths involved in the marketing of traditional medicines, in contrast to the conventional drugs which released to patient normally by the doctors or pharmacists only. We have this misconceptions. Oh, if you take this conventional tablet or capsules, or there will be lots of side effects. Please don't take this one. It will have lots of side effects. That is a general perception. No doubt it has. I don't deny it has the side effects, but that is a general misconception that, okay, if you want to be safe from these side effects by the conventional medicines or the Western medicines, use traditional medicines because they are free of all these side effects. That is and how this is weaved in our brains because of the publicity and the myths that these traditional medicines, they are very safe. So beside the belief of the positive impact of using these traditional remedies due to its ingredients, which are made from the natural substances compared to synthetic substances. As I mentioned, I repeat again, This is a common misconception globally, that the traditional medicines, they are taken from the nature, they are taken from the green source, and they are safe. That's why I put this question: is green is always the safe? That is a big question mark. We will see later. And please don't get me wrong. I myself, I'm doing lots of research on the traditional medicines, because there is no doubt that these herbs, they have the pharmacological effects. Definitely they have the pharmacological effects, but the only thing which we have to keep in our mind, that not blindly these all medicines, they are safe. Just again see these traditional medicines in the different parts of the world. So again, if we see the historically, the Asians, actually not Asians also, if you read the history of the Latin America, they are also well known for their high dependency on the traditional medicines. But if we talk about the Asians, definitely we can have the Chinese medicines, we have the Indian Ayurvedic, we have the Unani, we have this Siddha formulation, and there are quite a number of traditional medicines. And as we all know that India is rich in these traditional medicines. So beside these conventional pharmaceutical products, we are highly dependent on these traditional medicines. And in spite of aggressive marketing policy of these major pharmaceutical companies, the popularity of the traditional medicines is increasing, not only in the Asian countries, but also in the West, and of course in the United States. So now, as I mentioned that in the beginning, that I will give you some figures of the dollar and cents, that how big this market is. How big is the prospects of these traditional medicines? So recently, these traditional medicines, they become more popular, not recently, actually, but the last 1 decade. They're more popular in the Western part of the world, and in Europe, the total sales of the herbal medicines in 2018 reached more than 3.7 billion euro. And I'm sure that by another last year, this number has increased. And if we talk about China, in 2018, the sales revenue from the traditional Chinese medicines reached more than 14 billion US dollars. 14 billion US dollars. So you can imagine how big this market is. And there is 23.8% increase over the previous year from 2017. Now we can see US. If you can see the US market, according to this US government survey in 2019, 36% of US adults aged 18 years and older use some form of complementary and alternative medicines. So you can imagine that it's not only the developing countries, the use of this complementary and alternative medicine, they are equally popular in the Western world as well as in United States. And you can see that in USA, the total usage of complementary and alternative medicine is estimated more than 2 million US dollars. More than 2. And I think this figure is again also increasing. And as I mentioned in the beginning, that the history of Latin America is also very rich. And these people, they also have their own traditional beliefs on the use of the traditional medicines. So in Latin America, the population continue to use traditional medicine as a result of historical circumstances and their cultural beliefs. I give you some examples from Malaysia. So in Malaysia, the traditional medicines or the folk medicines, they are widely used because for the information of my friends who are not in Malaysia we have three major ethnic groups: Malays, Chinese, and Indians. And all these three ethnic groups have their own culture and traditions, and they use the traditional medicines. Malays, they have their own cultural beliefs to cure certain diseases, and they use the certain herbs and traditional medicines. The Chinese in Malaysia, they have their own traditional beliefs, and they use this Chinese herbal medicines. And also, of course, we have Indians in Malaysia, and they have their own cultural and historical beliefs for the cure of certain diseases, and they use this medicine since ages. And if I give you the amount of this traditional medicine market in Malaysia, you can see that there's a huge demand of traditional medicines, has been driven the total market for traditional medicines to more than 29 billion ringgit Malaysia, which is roughly, I'm not good in mathematics, but roughly maybe around 5 billion US dollars. 5 billion, around roughly that, 4 point something billion US dollars. Because Malaysia is a country which is blessed with, because we situate near the equator, and it is blessed with the abundance of varied medicinal plants, and currently Malaysia is among the world's 12 mega biodiversity rich countries in terms of number of plants and species. So there's lots of medicinal plants research is going on in Malaysia. Therefore, in Malaysia is set to lead the herbal market with its rich biological, heritage, cultural background, and trade links. As I mentioned that in Malaysia, we have three major ethnic groups, and all they have their own beliefs. That's why the market is very big. And in spite of the huge usage of these traditional medicines in Malaysia, very few systematic studies have been reported so far. There are research is going on, but still, because we have a huge amount of plants and the traditional beliefs, that not all these plants have been reported properly, or I can say the pharmacological studies or the pharmaceutical chemistry studies have not been done fully. Of course, I'm not expert from the Indian market, but I got some information about India, that the Indian plant extract market is witnessing an astonishing growth, as there has been a shift of universal trend from a synthetic to herbal medicines, and that source is from the research and markets last year. And again, the most important thing in this world is the economics. The economics, how much big is the market? And you can, I'm sure that you are surprised, or if you know this thing, the Ayurveda market in India was valued at 300 billion rupees in 2018. I'm sure that you can convert into US dollars. And the story doesn't end here. It is expected to reach 710.87 billion rupees by 2024. And that is also the sources from the Research and Markets 2020. So we can see that how much huge the market is for this traditional and complementary or alternative medicine. And again, I go back to this The reason is the beliefs. And again, I'm repeating myself. These medicines, they have the effect, definite effect. We cannot deny that these, if they don't have the effect, we can't see this big, huge amount of money involved in this type of drugs or medicines. Okay, now my point which I would like to highlight today is that yes, traditional and complementary medicines, they definitely have the pharmacological effects. We cannot deny, I cannot say this thing, oh, these all traditional and complementary medicines, because I have studied, I have done my PhD, this and that, and I don't believe in traditional and complementary medicines. No, they definitely, they work. They have the pharmacological effect. And if we see the history of this, even modern drugs, many modern anti-cancer, cytotoxic, and there will be a lot of other drugs which the source is from the plant. I just give here one example of vinca, not forgetting vinca. The most famous anti-cancer drugs from the vinca alkaloids, from the vinca plant. And then there's a long list. We have the reserpine, we have the yohimbine, we have the natural plants which have this, like the statins, and there's a long list of the plants which have the pharmacological effects. So definitely there is a effect. But the thing is, we are still looking for a magic bullet. The magic bullet which can work like an ideal drug without, I mean, maybe is my wishful thinking, a drug with a targeted effect, with the minimal, or if you allow me to say, with no side effects. I mean, being a student of pharmacology, I cannot say this thing, any drug without any side effect, but that is the, we hope. Maybe one day we can find this type of drug. So that is, we are still looking for this magic bullet. So we are still searching. And that is the nature of the human being. We are looking for this magic bullet, and we hope that maybe one day we will get. And as I mentioned, this one is, I'm repeating this thing, which is the main message here. Please, we should remove this misconception from our mind that everything which is green is not safe. All the herbal medicines, all the traditional and complementary medicines, if we take, they are safe. We have to remove this misconception from our minds, and also being in the healthcare professionals. I'm a pharmacist. I'm sure that we have other pharmacists, fellow friends who are listening to me, my other fellow friends who are medical doctors. We have to educate the general public about this thing, that these complementary medicine or these medicines, they are not free from side effects. So now the other part of my my presentation, I just want to show you some other side of the stories for those who have this misconception that these drugs, they are very safe. Just to give you the example from Malaysia, according to Ministry of Health Malaysia, the data from Hospital Selayang, Malaysia, which is the National Tertiary Referral Center for Liver Diseases, showed that 42% of drug-induced acute liver failure cases from 2001 to 2017 were possibly due to traditional and complementary medicine. The word used possibly is that sometimes the patients, when they come to the hospital, they are scared to tell that they were taking the traditional medicine. But that is the figure which we have, that 42% of drug-induced acute liver failure cases. they were possibly due to traditional and complementary medicines. This is one of the examples which I just quote from Malaysia. And I just got this from the newspaper, that the Times of India, April 30, 2019, it was mentioned by Dr. K. Sarin, who is the Director, Institute of Liver and Biliary Sciences, mentioned that he gets 1 to 2 cases of drug-induced liver failure every week. You can imagine how much is the people they are thinking, and they are misusing this complementary or alternative medicines. And the alternative medicines or herbal drugs are the most common culprits. That's his words in the Times of India. And there's another reference from the Indian Journal of Clinical Biochemistry in 2016, that the herbal medicines may contain potentially harmful levels of heavy metals, and people who use them are at the risk of developing associated toxicities, especially the liver and kidney. So the thing is, we have to be very, very cautious for the use of these traditional medicines. Health hazards due to the use of traditional medicines, they are often reported, as I have given you a few examples. Inappropriate consumption of herbal preparations can cause the serious health complications. The herbs usually contain, we all know, they contain the biological active ingredients. As I mentioned earlier, as a student of pharmacology, I can say this thing, that these extracts definitely they contain the active ingredients, and therefore the improper use may cause the toxicity. So the important word here is the improper use. Please don't get me wrong. I'm not totally against the usage of alternative and complementary or herbal medicines. But the word which I would like to emphasize here is the improper usage. The proper usage, yes, but the improper usage may cause the toxicity. That is the most important point here. And it is very essential to avoid such toxicity. The toxic dosage should be determined before dispense and consumption. And that is the job of our healthcare professionals. The toxicity mainly comes from the ingredient itself or from the processing part. And the sad part is sometimes the popularity of these traditional medicines has been exploited by adulterating with the organic or inorganic substances. That is another dangerous thing, which normally happens, and it can cause the chronic or acute toxicity. Sometimes maybe the label claim is different what is inside the box. That is also, and it may, so if any patient, even if can go to any pharmacist or doctor and say that, okay, this medicine contains this thing, and based on our knowledge, we know that, okay, this does not have any interaction with any drug, and we can say to the patient, yes, you can take this. But the problem is if that drug is adulterated with some other material, that will definitely cause the toxicity to the patient. So all herbal medicines should be used cautiously, even though they seem quite safe. Because some herbs, they are toxic when it's taken in combination with modern medicine. We all know that most of the drugs, when we take, the main enzyme, our cytochrome P450, maybe some herbal drugs, they have the interaction with this enzyme, and eventually it may cause the interaction with these medicines. So we have to be very cautious. We have to be very careful. When we take any herbal drug, we must consult the pharmacist or must consult our physician, because there are lots of, I don't want to give you the example, and you all may know that St. John worts, their grapefruit juice, the ginseng, they all can alter the levels of the enzymes in our body, which can eventually affect the concentration of the other drugs which we are taking. So maybe the toxicity is not due to the herbal drug, but because the herbal drug interacts with the metabolizing enzyme in our body, and it will eventually cause the toxicity because of the other drugs which we are taking. So it is very, very important that if we have to tell the people that if you are taking the conventional medicines and you want to take the complementary and alternative medicines, you have to be very careful. That's very important. So again, it's not because of maybe the problem is not because of the complementary medicines, but because these medicines affect the metabolizing enzymes, and then eventually it will cause the damage to our liver and kidney, or maybe other parts of the body. My another personal interest is on the heavy metal detection in the herbal medicines. And we all know that these all heavy metals, they have this dangerous effects in our body, like lead, mercury, cadmium, and arsenic. They are known to be found in the traditional medicines. And of course, we all know that this lead, mercury, cadmium, arsenic, all these heavy metals, they have the potential side effects or toxic effects. They have toxic effects on our brain, they have toxic effects on our kidney, liver, and many other organs, vital organs in our body. So the presence of these heavy metals usually develops either from the environments and conditions that the medicinal plants are grown or collected, the conditions under which they are dried and processed, the storage environment, and the conditions during their transport, the manufacturing process when the ready-made medicinal products are produced, or sometimes maybe they are adulterated, as I mentioned in the previous slide. So we can see that I just give you a few examples of these heavy metals. For example, we know lead. Lead poisoning occurs when the concentration reaches between 10 to 14 microgram per deciliter. And the signs of this lead toxicity include the central nervous system effects. The main is the encephalopathy or the memory loss, effect on the gastrointestinal tract, and also it has the effect, it can cause the anemia. And many studies have been made about the heavy metal toxicity associated with the consumption of traditional medicines. For example, again, there's a specific case study found that 59-year-old women unknowingly consuming 15 milligram of lead together with traditional medicine, because she was not aware that that traditional medicine was adulterated with the lead. And eventually she ended up in the hospital and was treated with the chelation therapy. The next heavy metal which is of our interest is, of course, or is present and or adulterated in the herbal medicine is mercury. Mercury is a bioaccumulative toxicant that is easily absorbed through the skin. And the poisoning may occur when its level in the blood or urine is more than 35 microgram per liter or 150 microgram per liter. And high exposure over the long period of time will result in depression, irritability, brain damage, and ultimately death. And there's another case which was reported of the mercury poisoning. The urine mercury level was 64 milligram per liter after the duration of 5 days intake of traditional and complementary medicine, and it results in the death of that patient. So we can see that how dangerous these heavy metals they are if we take these drugs without the proper consultation. And so the next one is, of course, we all know is the arsenic. It is then abnormal arsenic levels in the blood for adults is more than 100 to 200 microgram per liter. The lethal dose range is 120 to 200 microgram. And in acute arsenic poisoning include metabolic and hepatic effects in addition to neurological symptoms. So I will just summarize now that in Malaysia, I'm sure that in other part of the world, like in India also, the government, they have now rules and regulations about the use of the complementary and alternative medicines. So that for the traditional medicine products, there is a Control of Drug and Cosmetic Regulations Act 1984, and also there is a quality and safety criteria that the limits for the heavy metals and microbial contamination, there's a limit, and if these complementary or traditional medicines, they have this above the limits, they are not passed. So you cannot market that. Also, the absence of the steroids and other adulterants. Also, the prohibition of the herbs with adverse effects. There are certain herbs which are prohibited. So if we see the website of this our Malaysian pharmaceutical division, there's a website, and then we can see that what products they are, even the products which are banned or prohibited, and why they are prohibited, because of the use of certain herbal products. And then of course there's a regulation that there should be a compliance to the good manufacturing practice, and I'm sure that definitely in the other part of the world and in India also you must have this type of regulations. So what basically we can do, and what I myself I'm doing with my postgraduate students also, the detection of these heavy metals in the traditional medicines, and what we are doing for this detection, we do the several techniques, either with the titration or spectrophotometry or chromatography or atomic absorption or emission spectroscopy. And among these, the most what my students they are using, the AAS is the most sensitive, reliable, and less complicated technique. Definitely the other techniques also we can use, but this is what we have found that is most reliable technique. So I would like to conclude this, that traditional and complementary medicines, I'm repeating this one, that they have the pharmacological effects, but they must be used with care and caution. And it is our job as a pharmacist, as doctors, to educate the general public about the use of this and also I can say the misuse of this traditional and complementary medicine. And I always tell this quotation to my students, and I would like to share with you. I'm sure that if you know this quotation or not, it's very interesting, from the chemist of the 14th century, Paracelsus, that all things are poisons, for there is nothing without poisonous qualities, and it is only the dose which makes a thing poison. So the message is that, yes, the only thing we have to, if we use these traditional medicines, complementary medicines, we have to use appropriately, with the appropriate dose, with the appropriate consultation. I would like to end my presentation here, and once again I would like to thank my friends in who have arranged this webinar and gave me this opportunity to present today. Thank you very much. Over to Mr. Prasanna.
Yes, sir. Thank you, sir. Thank you very much.
Yes,
So,
thank
Dr.
you very much,
Yes.
sir. Yes, thank you very much, sir. Sir, we have little bit questions, sir, for you, sir.
Yes, yes, please.
Yeah, you mentioned that magic bullet, sir. This is very good phenomenon nowadays. So that may be useful for the anti-cancer treatment and the cytotoxic treatment, sir. So if the magic bullet works on cancer treatment, so most of the people are relieved from the cancer also, sir.
Yes,
And
definitely.
also, yes, sir. You mentioned that the Ayurveda market in India that is 300 billion in 2008. So there is a very good phenomena, but some of the herbs are toxic, sir, and it is taken in combination with the modern medicine. Can you give any examples for that one, sir?
Okay, as I mentioned just now, that for example, we have this Saint John words. We have this ginseng. All this,
Yeah.
all these herbal medicines. When we
Yes,
take
sir.
with our conventional medicines, because these drugs, even the grapefruit juice, it has the
Yes.
direct effect on the cytochrome P450 system, which is one of the major enzymes. We all know that major enzyme system. And once we take these drugs, and at the same time, we are taking our conventional drugs, so
Yes.
they definitely can have the cause the toxicity of these drugs. So sometimes, as I mentioned, the toxicity is not because of the complementary medicine, but because the complementary medicine is affecting our metabolizing enzyme, and that lead to the toxicity of the conventional drug which we are taking. So that's why when my message is very simple. If somebody is taking the conventional and traditional medicine together with the conventional medicine, if possible, don't take. If possible, don't take, because we don't know that this traditional medicine might interact with the conventional medicine. I hope I answered your question, Dr. Rao.
Yes, sir. Yes, sir. So basically, that most of herbal medicines are giving complications, sir. So we cannot take without prescription. We cannot take without any help of from the doctor also.
Yes,
So
very right.
is there any drug for anti-cancer, sir? Now the market available drug, herbal drug, right
Uh,
now, which is one prominent one.
okay, I cannot name, but there are quite a number of studies have been they are undergone, or they are not at the even at the clinical trial level, but they are many groups in Malaysia who are working on the anti-cancer activities of these herbal drugs.
Yes.
There are quite a number of drugs.
Yes. Yes.
Even the most common one is the this ginger and gingiber. You all are
Yes.
familiar. Even this one is still, the work is going on that one,
Yes. Yes.
because it has
But
the
in
anti-cancer activity.
yes. Yes, sir. But local something is going on, sir. Whether it is rumor, I don't know. That Ayurvedic products are it gives hike in temperature. Whether if you take the Ayurvedic drug, it gives rise in temperature. Is it correct, sir?
Uh, I have no idea, because pharmacologically I don't think so, unless until if these drugs they act on our hypothalamus.
Hypothalamus. Yes, sir. Yes, very good.
then
Yeah.
then definitely they will
Yeah.
have the effect on our body temperature. If they don't
Yes.
have the effect on the hypothalamus, I doubt that they will increase or decrease our body temperature.
Yes.
But
Yes.
what
Very
we
good.
know
Very
that
good answer.
definitely many drugs, they have this effect on the central nervous system, so maybe they can
Yo.
affect the temperature. Yeah.
Yes. Yes, sir. Sir, can I forward to our MD sir, sir, Shri V.V. Ratnakar Reddy garu? So he is
Yes,
online,
please.
sir. He will
Yes,
ask the
please.
question.
Yes.
Sir Ratnakar, sir, please. Prasanna Ratnakar, sir, given.
Sir Ratnakar sir, can you please speak with Dr. Syed sir?
Okay. And
Sir,
okay,
maybe
Prasad.
some network problem. Sir,
Next problem.
student,
Yeah, yeah, yeah,
sir, some students are posted some questions here. Can I ask them?
yeah,
Can I ask these
yeah, yeah.
questions?
Yes, yes, yeah. You can
Yes,
ask.
please.
Sir Vijayanand, he asking that is there any book to refer for herb and herb drug interactions? Is there any book to refer?
Books at I think because on the herbal medicine normally I go for the for any books on the pharmacology.
Okay, sir.
For any pharmacological activity book, normally I myself I use the Mr. Dr. K.D. Tripathi's book, which has the lots of pharmacological effects on the and even the it has mentioned also the some drug effects of the herbal effects of the drugs also. So K.D. Tripathi is one of the which I'm using since my undergraduate level. It's one of the very good book in pharmacology.
Okay, sir. Sir, one more question, sir. How can we differentiate herbal medicine with conventional medicine?
Okay, no. What I mean conventional medicine is like if I give the example like this Panadol or like other normal drugs. So that is the conventional drug. I mean in this presentation, I mean the conventional drug is the Western medicines, and traditional medicines are the medicines which are the folk medicines.
Okay, sir. Okay, sir. Students received valuable information from you, sir. Thank you very
Oh,
much from
you're
student side.
welcome.
Yes, sir.
Yes, sir. Yes, sir.
Sir,
Sir,
PV Ravi, can you speak?
sir. Yeah, yeah.
With
Sir,
the permission
I
of the
request.
chair, can I be able to
Y-
speak for a moment?
yeah, yeah, sir. We are waiting for you, sir. Sir, he is
This
Miss
is Ratnakar.
Shri
I'm
Vivid
a part of
Ratnak.
St. Mary's team. Am I permitted to speak for a
Ye-
moment?
Yes, sir. You can.
Can you hear me, Professor Dr. Atif?
Yes, I can hear you very clearly, sir.
Yeah, very good morning. And I'm a part of St. Mary's team and part of Dr. P.V. Rao's team. And first of all, at the outset, I thank you very much for conducting this, for hosting this session, which is very useful and definitely taught in the pharmacy colleges in general. And thank you very much for hosting the session and being a wonderful message giver to all our students and other members too. And my question to you is, definitely, as you have rightly said it, the pharmacological effects of herbal medicines have been proved beyond doubt. And in many of the countries, they are the basic substitutes wherever there is no allopathic drugs that are in use. But are there any research that is being undertaken in any of the countries in a big way to reduce the toxicity of the herbal medicines? Because once the toxicity is reduced, definitely, that can be populated across the countries. And definitely it is useful because of the uh, price factor also, because it's available across, uh, you know, various countries, and it doesn't cost much. So, is there any research that is being undertaken in a big way to reduce the toxicity without reducing the good effects of the drug, pharmacological effects of the drug? If so, which are the institutions which are undertaking this research?
Okay, thank you very much, Mr. Ratnakar. And once again, thank you very much for giving me this opportunity through your prestigious St. Mary's College. Okay, your question regarding the research on reducing the dangerous side effects of the herbal medicines. Definitely, I know in Malaysia, there are, even in our university, Quest International University, we have our postgraduate programs, and we are doing the lots of herbal research. And what we are doing under the umbrella of we have a center of drug formulation, and we basically, what research we are doing, we are converting the traditional medicines into the modern medicines. And how we are doing, we do there are different ways, either by extraction, a single compound, or maybe what we do, we just extract the actual compound, and then we convert it into a modern formulation, like we can convert into creams, into lotions, or even into the conventional tablets. So even in our university also, we are doing lots of research on the different herbs, on the different ailments. At the larger scale in Malaysia, we have lots of other institutions backed by the government, and they are doing lots of research on because this agriculture research, it comes under the agriculture research. Many government universities in Malaysia also, they are doing this research, and many, as I mentioned, that even our university also is very much, we have the expertise. And if, in future, I hope that if you have any kind of collaboration, we have our center of research and formulation. We can be of any use for this type of research, because I know that of course India is rich in the Ayurvedic medicines, and I think we have to get this opportunity by doing the collaboration with your institution also. I hope I answered your question, Mr. Ratnakar.
Yeah, thank you so much, sir. Thank you very much.
PV Rao, sir, can you?
Yes, yes. Yes, sir. So is there any questions?
Sir, one more question is there, sir.
Yeah.
Question from Sai Vinjasri. So the question is that herbal products can be formulated into dosage form is very difficult. Why? Because these are insoluble in nature. So at that time, how we can combat that disadvantage? How we can increase the solubility of that herbal products?
Okay, of course, is a very good question, and I think maybe I'm not the right person, because I'm not the formulation man, but definitely, as I mentioned, that we have the people in our formulation which can make the formulation. No doubt that when we try to convert into the formulation, sometimes there's a change in the activity. Sometimes we cannot change the color. Sometimes, as you mentioned, is the solubility is a major factor. But I think that is the job of the formulator, and that what we study in our pharmaceutics and pharmaceutical technology, that how to overcome these problems. Definitely, if we use the raw materials, it is very hard to convert into a formulation, and then either we have to combine it with other ingredients or excipients to make it more useful. So that is the job of our formulation pharmacist. But you are right, definitely it is difficult.
Yes, Prasanna,
Thank
you
you.
are?
Yes, sir. It's completed, sir. No.
Yeah.
Yes.
So I request to all the participants, if you have any doubts in this session, so I will give the email ID about Syed sir, so he can answer the question through email also.
Yes, please.
So we can share the mail ID also. So is it okay, sir?
Yes,
Syed
please.
Sir?
My
Is it
pleasure.
okay? Yes.
My pleasure.
Yeah, yeah.
Thank you very much.
Yeah.
Yes.
Yes, sir. Thank you very much, sir. Students, we are very much lucky enough having such a eminent personality as a resource person for today's webinar classes. Sir have always been amazed by his ability to make even the most complex concepts It is very understandable. He is widely sought after as a lecturer, and he is always willing to mentor the students also. Even when they are not his own student, he has often been known to spend hours of time at a scientific sessions and meetings to help the student. So to other students also. So when I was thinking about this webinar classes, I heard about sir to my dearest friend, Dr. Vijay Kotra, who is working as an associate professor in the Quest International University. He told many things about Dr. Syed sir, his activities and things over and over. Sir is the best teacher and boss also I have ever heard. He always took time to explain. So today we have Dr. Syed sir with us. It is such an honor for us to have today between us. Thank you so much, sir, for coming through this webinar and bestowing us with your own presence, sir. Thank you very much. And also, I thankful
Thank you very much, Dr. Rao.
yes, sir. I thankful to Vijay Kotra for taking you, sir. And also, I thanks to Mr. Prasanna who has given this technical time, technical field also. And also, I thank to all participants, students, and academicians, faculty, all the from different colleges for the successful webinar. This is the first webinar in the St. Mary's system, online webinar. Thank you very much for your concern.
Thank you very much. Thank you very much, sir. Okay, bye-bye. And have a nice day.
Bye. Thank you.